In this video, I'm going to provide a basic overview of the sinuses, the conditions that impact the sinuses, and the medical and surgical options currently available for treating sinusitis. I'm also going to discuss a few things to keep in mind when selecting a specialist to assist in treating sinus problems. Hi, I'm Dr. Allen. As a rhinologist or a fellowship-trained sinus surgeon, I've dedicated my career to understanding and treating sinus problems more than any other condition. Hopefully, I can impart some of what I've learned and help those suffering from sinus problems determine what treatments are needed for lasting relief. To start off, let's make sure you understand what the sinuses are and how they function. There are 4 sinuses on each side, including the frontals in the forehead, the ethmoids between the orbits or eye sockets, maxillaries in the cheeks, and sphenoids behind the other sinuses and near the center of the head. When healthy, these sinuses are filled with air and a thin mucosal membrane covering the sinus walls, which produces a layer of mucus constantly. This mucus is carried by microscopic cilia, or moving hair-like structures, towards small 1 to 2 millimeter natural sinus ostia, or openings. When the sinuses function well, this constant flow of mucus removes any debris or germs that manage to enter the sinuses. When the sinuses are inflamed, the mucosal membrane thickens, the mucus production increases, and the cilia slow down or even stop moving. The term sinusitis refers to this inflammation and dysfunction within one or more of the sinuses, which may or may not involve bacterial infection at any given time. Chronic sinusitis lasts greater than 3 months and impacts about 12% of US adults. Triggers for chronic sinusitis include airborne allergies such as dust mites, pollens, repeated exposures to viral respiratory illnesses, or other airborne irritants such as cigarette smoke, anatomical abnormalities such as a significantly deviated nasal septum, and factors that weaken the immune system such as chemotherapy or longer doses of steroid pills and other medications that suppress the immune system. Acute sinusitis lasting less than a month, and significant flare-ups of chronic sinusitis are generally caused by more intense inflammation during viral respiratory infections such as colds, influenza, and more recently COVID, or greater than usual exposures to airborne triggers such as pollen seasons. The excess mucus trapped within an obstructed sinus allows bacteria to proliferate, similar to the formation of an abscess. Dental infections approaching the apex of the upper molar roots may also spread bacterial infection directly into the maxillary sinuses. Bacterial sinusitis is suspected when purulent or discolored drainage is present, or when acutely worsening symptoms such as facial pressure and pain are accompanied by other signs of infection such as fevers or chills. Most acute bacterial sinus infections following viral illness resolve on their own within 2 to 4 weeks, but treatments such as decongestants, nasal sprays, and occasionally antibiotics are often used to speed up this recovery. Sinusitis resulting from airborne allergies may spontaneously improve when the offending pollens are out of season, and I'll discuss more specifics on treating these forms of sinusitis in a moment. In the case of dental infection-related sinusitis, both dental and sinus procedures may be required depending upon the severity and duration of infection, as the types of germs involved are often more challenging to treat. Chronic sinusitis can be further divided into those with or without nasal polyps. Nasal polyps form in those with specific abnormalities of immune function, such as high eosinophil counts, which are one of the types of white blood cells that are important in allergic disease. Nasal polyps are frequently noted in patients with allergic fungal sinusitis, where thick semi-solid debris forms in the presence of mold contaminating the sinuses, and this triggers an aggressive inflammatory response. Nasal polyp patients often have asthma or chronic bronchitis symptoms that worsen when their disease is poorly controlled. While their nose is often obstructed by polyps on one or both sides, and their sense of smell is often dulled by these obstructions, they generally do not experience the degree of pain or pressure noticed commonly in other forms of sinusitis, except when bacterial infections cause flare-ups. Chronic sinusitis without polyps involves more than 3 months of inflammation and swelling, which impairs the function or outflow of one or more of the sinuses. The absence of polyps and lower incidence of asthma and other lower airway symptoms makes this more common form of sinus problem challenging to identify. Often it is present for years and causes mild to moderate symptoms that are attributed to allergies and frequent viral illnesses before eventually being identified after antibiotics and other treatments fail to improve the symptoms adequately. Complicated sinus infections can occur with any of these forms of acute or chronic sinusitis and involve infections spreading to other areas such as the orbit or eye socket or within the head, causing meningitis or potentially life-threatening illness. Though complicated sinus infections are rare, they are emergencies generally requiring surgical drainage of the sinuses and aggressive antibiotic therapy. Vision changes, confusion or altered mental state, or obvious swelling or redness of the eyelids and surrounding areas of the face might suggest the presence or the development of serious infection and warrant an evaluation in the emergency room setting. Luckily, most cases of chronic sinusitis are quality of life problems rather than life-threatening emergencies at the time they present to the ENT clinic. Nasal endoscopy and CT imaging are often used in the clinic to assess the condition and provide targeted treatment recommendations that are more likely to succeed. If the history is also consistent with underlying allergic sensitivities, allergy testing may also be recommended to determine if immunotherapy in the form of allergy shots or drops might improve symptoms. This is particularly important when allergies are the primary source of inflammation. Medical treatments are tried first, except in specific cases where only surgery is expected to succeed, such as when significant allergic fungal sinusitis or a mucocele where a sinus expands beyond its usual boundaries are noted on CT imaging. Unless recently attempted, antibiotics are often prescribed as bacterial infection might be a significant ongoing source of sinus inflammation. Oral steroids may also be used in moderate or severe cases to relieve inflammation and swelling, particularly in those with evidence of polyps in their nose or sinuses. Topical steroid treatments are also routinely recommended and might include nasal steroid sprays or nasal irrigations with compounded steroids given to use in the rinse. It is important to treat underlying allergies as well, often by taking a daily antihistamine such as Zyrtec, Claritin Allegra, or Zizal. Nasal rinses with saline have many benefits, even without the addition of medications, as they clear mucus and debris that triggers the inflammation. If significant nasal polyp disease is noted, biologic medications such as Dupixent are often recommended, particularly when polyps recur after surgery and despite the use of topical nasal steroids. When medications fail, we rely on procedures to enlarge the openings of the sinuses. Sinus procedures have been proven more effective than medications alone in the long-term management or treatment of chronic sinusitis. Early, rather than delayed intervention has also been shown to improve outcomes, as long-standing inflammation and infection cause irreversible damage to the mucosal lining and the bony walls of the sinuses over time. Mild to moderate cases may respond well to in-office procedures such as balloon sinuplasty, particularly when any other anatomical factors such as a deviated septum are corrected. For this reason, these procedures are often performed under IV sedation or general anesthesia rather than awake in order to allow for improved comfort and airway protection and allow for these other concurrent procedures when indicated. Functional endoscopic sinus surgery, or FES, is preferred for any cases where larger openings into the sinuses are needed to either access pathology present or improve the long-term management of the condition. For example, FES would be preferred in the setting of nasal polyps, significant change to the bone and mucosal lining of the sinuses suggesting more severe inflammation, when the anatomy of impacted sinuses does not appear amenable to balloon dilation, such as a frontal sinus opening restricted by solid bone rather than crushable air cells, when allergic fungal sinusitis is suspected, which requires large openings for clearance of semisolid debris, when a tumor is suspected or a biopsy is needed from within a sinus, and when other conditions might be expected to worsen sinus inflammation and necessitate ongoing topical steroid therapy for long-term control. This is very important to consider, as current trends towards office sinus procedures are tempting in comparison to traditional FES, with promises of a quick fix and an easy recovery. A well-trained rhinologist will take the time to evaluate and explain your condition and the likelihood that you can find long-term relief with an office procedure versus traditional sinus surgery. You should trust that your surgeon is taking the time and has the experience to tackle any degree of sinus problem, or you're more likely to end up frustrated and in need of revision surgery for relief in the future. Good post-operative care is also essential for improving the long-term outcomes following sinus procedures, and this should be provided by the surgeon so that healing and inflammation can be managed appropriately. While procedures can effectively cure certain sinus problems, most patients have some degree of inflammatory sinusitis that requires ongoing treatment for relief. Milder cases are often controlled with intermittent nasal rinses, steroid sprays, and allergy meds when symptoms are noted. More significant problems might require routine use of medicated sinus rinses or sprays, immunotherapy for allergy control, regular visits to assess response to treatment, and biologic medications such as Dupixent for persisting or recurring nasal polyps. If you made it to the end of this video, here's the best piece of advice that I can give to treat sinus disease and get back a normal quality of life. Find a genuine rhinologist willing to educate, explain why a specific procedure might be needed, and who is known both for their surgical expertise and their ability to manage tough cases long term. I'm Dr. Allen, a fellowship-trained sinus surgeon in Houston and the Woodlands, Texas. If you would like to see me as a patient, please call my Houston surgeons at 713-791-0700 or request an appointment online at premiersinus.com. Virtual consultations are available for those unable to travel to our offices. Thanks for watching.